All right, let's get into Wired Wednesday. McKinnon is here. MJ with Farm Bureau Financial Services.
Good morning, everybody. It's Wired Wednesday with McKinnon Hansen. Technically,
all right.
I don't watch any sports, so
What?
all of that is
What?
entertaining to me.
How dare you?
She isn't talking about them either.
Yeah, and no, it's so much more things to track, and my brain doesn't have the
But it's
capacity.
Utah and BYU. It's the most important thing in the world.
I'm exercising my right to not agree.
But
It really is because there are so many other
but
things.
BYU, Utah.
I'm picturing your bumper stickers in my mind right now.
Yeah, for sure.
How can you like both at the same time? Plus,
It's because it's BYU and Utah.
I guess technically, our our blood veins are, blue before, and then they bleed red. So, I guess they're kind of connected. I don't even know. Sports is way over my head. The last time I watched sports was in high school, like high school football, okay? I knew how to run chains a little bit, and then into college.
Were you on the sidelines?
I did. I helped my dad with the sidelines. For
Really?
football, specifically. Past that, I did not do anything else. And then
Not a cheerleader?
I was a cheerleader my senior year.
Okay.
But past any of that, I don't know who's on the whatever league and this league of baseball. I do like a good baseball game.
Okay.
That's the
Yeah.
the American soul
I
right
actually
there,
watched
right?
part of the Field of Dreams game the other night.
Oh, nice.
Yeah, I did.
Oh, that's good.
Not the movie, the actual game they had.
Oh, way fun.
Oh, you don't know about this?
No.
So for the last couple of years, they built a ballpark out in Iowa, at where they did the movie, and they've played major league games there for the last 2 years.
Oh, how fun.
Now, they won't next year, at least, because they're going to be working on the stadium, making it bigger.
Right.
But it's just a cool experience. Tammy and I have said that we're going to go back there.
Oh, that's way cool.
Yeah.
Yeah, so I don't watch sports. It's not my thing. Well, so good morning.
But let me play the trump card one more time.
Okay.
But it's BYU Utah.
And that means no significance to me. I am just not into the whole we're better than you because we're blue thing. I have no idea. That was straight off the cuff, by the way.
Yeah, but by the way, you might have noticed that with cynicism on our part. I think Chris and I are of the opinion of the college teams that are in state. We're happy with the one here in Cedar City.
Yeah, it adds a whole nother level to the drama that goes on in the world that I try to ignore most of the time because it doesn't affect my everyday life, my specific everyday life. Now, those that do, I appreciate you guys having entertainment and going out and doing those things. It's just not a part of my life. So, anyways, back to the topic at hand. This is Wired Wednesday with McKinnon Hansen, your local Farm Bureau financial agent in studio today. I am so excited to have her in. We have Dr. Rebecca Whittaker from Whittaker Chiropractic. And me and her have been friends over the last 4 years now. And we have had so many different conversations. And I ran into her yesterday, and we started
Hence
talking.
the need for a chiropractor because you crashed with her.
Right, basically. Yes, I crashed into her for sure. And we got talking about all of the unknowns that people go through everyday life with not knowing that they can, kind of do preventative care for or preventative maintenance type of a thing. How are you doing this morning, Becca?
I'm doing great.
That's awesome.
I'm really happy to be here and teaching people about things they might not know that's random stuff that always lives in my head.
Well, no, and it's perfect because, in a body we have 206 bones, we have 600 muscles, we have close to 90 organs, and all of those can have shifts or tears or things that associate with them, painful things. Your body absorbs trauma, it absorbs everyday life, and it's incredible the structure, the core of it, and how that can be affected.
In the saying in the chiropractic world is that structure determines function. There's just a lot that people don't realize about how much really goes on to make your body work and feel well. Sometimes I think we feel entitled to it, but when you talk about all those numbers, plus on top of that is fascia that covers every organ, every muscle in our body. It acts kind of like a layer of saran wrap, if you will. And you know how when you pull out a piece of saran wrap, if part of it gets jumbled, it kind of screws up the whole piece.
The whole roll.
That happens in fascia all over our bodies. We get scar tissue. It pulls muscles to work a little bit differently. Also, I mean, our hormone function affects how stretchy our ligaments are, how strong they are. Our blood sugar, what we ate this morning affects our blood sugar, which affects our hormones. Like, we're just a big mix of everything affecting everything.
All the time. And somehow we still mostly get up in the morning.
It's amazing.
Mostly function.
Yeah.
But we choose not, some of us choose not to address some of the pain points in our life with our body. Like, my hips are aching, my knees are aching, you know, being, you know, carrying with child, like being pregnant, all of the pains associated with that. Sometimes those are normal and sometimes those are not so normal.
I would say I understand that deeply because that's exactly how I felt. Both, I think the reasons people don't do care, you know, there's a lot of reasons. There's sometimes financial, but a lot of it is we either think it's normal to have that, especially in pregnancy or with pediatrics, which I know is a part of what you wanted to talk to me about today. But we think some things are normal that actually aren't. They're just common when you're pregnant or if there was a difficult birth with the baby. Other reasons are sometimes I think we look at our bodies as something that we need to like control or suppress the signs from, to be tough or not to be whiny.
Oh man.
Like we just tell it what to do and it will do it. And to be honest, our bodies are good at doing what we ask them to do, but sometimes they can only give so much or do so much. And if we can help them to function better, to have a better structure, things are just much simpler. The way we move, the way we feel. I mean, the way we feel is based a lot on how we move. There's a lot you can do, so you don't have to feel like you have to be so
To cloud it over.
help it.
So what's one of the most common, oh, this is just a pain thing, but it can be resolved?
In general population or in pregnancy or
Both.
So men in pregnancy, women just often think they have to deal with a lot of stuff.
Sciatic pain.
I'm like, the most common would probably be sciatica. So sciatic pain, the really strong pain that like starts in your gluteals and can go down your leg. I've seen it cause massive shooting pains down the leg. Problems in pubic bone or the groin area. So many women are walking around with the feeling like their baby may fall out if they move wrong.
Mm-hmm.
It sounds strange, but it's
Very
common. Or really strong pain at the bottom of the abdomen, and it can just grab you. And you're there trying to do something professional
Right.
or help another child, and it's really disconcerting. All those things are really based in the structure of your body. Your ligaments that attach from your uterus over to the bones in your pelvis and your hips. So if you've had maybe like four-wheeler accident and got tossed from your four-wheeler or bumped into something hard, any kind of accident really that's twisted your hips, it can be causing some torsion in your uterus as well. It can make difficult deliveries. It can make
Something that
painful
you would
sitting
have
of the
experienced 10 or 15 years ago is now manifesting in
Yep.
this one specific area.
Yep.
And you guys can help with that.
Absolutely. Our bodies adapt pretty quickly. It's incredible to day-to-day function, but once you put a baby there, your center of balance changes and it's kind of like a breaking point. It just can't adapt as well. So what we can do is go in and rebalance that. Balance out the muscles, mostly adjusting the bones to get them back in the right place. Whatever was twisted, we untwist, basically.
Right.
To get it back to its original healthy form. And that makes it so the uterus has more room for baby to grow. It means the baby's delivery is much safer. And squirrel.
I'm sorry,
And it
I'm
also-
sorry, we're busy watching BYU Utah.
Yeah, no, you're good. You're good.
So glad you're interested in pregnancy.
Yes.
Anyway, we make it so it functions as it's designed to. And not only does the pain go away, function goes up, safety goes up for mom and baby.
So in a more common population or non-carrying population, what's a common?
Oh geez, I mean, think of any part of your body. At our clinic, we do full body treatments. So we work on musicians that are having problems with their wrists or elbows. That so often has to do with bony alignment. That's actually how I got into chiropractic. I had what I thought was tendonitis and neuritis in my elbows. For 2 years, I lost my music scholarship. I was in college and couldn't write notes very well. I was in honor society. I had to figure out how to do all of that. And no one had any ideas in the medical field, so it wasn't bad enough for surgery on the physical side that they could see. And I was doing a lot of martial arts at the time, so I went to see a chiropractor because my neck was hurting from martial arts. But
Yes.
he heard about what was happening with my hands, asked if he could check out my wrist. He adjusted one bone in my wrist, and I felt nerve flow and blood flow back in my hand for the first time in 2 years.
Wow.
My eyes popped open, I looked at his face, and I asked him what I needed to do to be a chiropractor, because that was the most efficient treatment I'd ever seen. Work on that. I mean, people with neck pain, with headaches. Headaches are a huge thing. If your head is sitting just off of alignment of the top of your neck, it can create really tight muscles that impinge the blood flow up to your brain. Massive migraines, low back pain,
and so
knees, hips, everything.
Yesterday I went in and I was adjusted, right? But the treatment was so efficient that I immediately felt better, right? But who knew? Like for me specifically, right? I'll talk about all my medical stuff because it's, common knowledge. I'm not shy about any of it, right? But me being a mom and reaching back into the back seat, or me lifting kids and twisting, or doing all the different day-to-day things, all of my body decides to fall apart sometimes, right?
Yeah.
And then if relaxin, hormone through pregnancy is still in your body, that affects everything else still, right?
Stress hormones, any hormones really.
Right. So my entire rib cage had twisted,
Yep.
which caused ribs getting out of alignment. And there was how many ribs?
12 on each side.
12 on each side, right? And that's front and back. So you're like sternum and your spine connect all these ribs, right? So my rib cage shifted entirely, which also caused massive neck pain because now nothing's aligned right there.
Yep.
And headaches. I've been walking around for a headache for 3 weeks. Granted, it's not from your fault, it's from my own scheduling fault. But I knew that I would feel relief getting into a chiropractor and getting adjusted. And that's when we discovered everything was just out of alignment because of one thing.
This is where I feel passionate about it, truly. Because in your body, what it feels like is this super annoying pain around your shoulder blade and headaches, and you don't realize that it's all related. But if you can get into someone who looks at ribs, who looks at arms, legs, at the whole body picture, stomach, right? Because if your ribs had shifted, there was creating a lot of tension around your diaphragm. So when I can feel what's going on and get those ribs in, then instantly those muscles can relax. What I think is a really amazing thing about your body is it will guard itself. It's not just like putting you in pain for fun, really.
Right.
The ribs have so many nerve endings. One of the highest concentration of nerve endings in your body is where your ribs connect to your sternum or to your back. They're protecting your vital organs. So your body's like, hey, we need to protect your heart. If something isn't working right here, like please fix it
now.
Right. So when we release that, then it's like, oh, thank you. And I can let go of those muscles. Think of the people who are having decreased productivity because of headaches, because of heartburn, because of an annoying pain in their shoulder.
Posture.
And it's ribs that have shifted out of place. I mean, I was telling you yesterday about we have patients who have spent thousands and thousands thinking a problem was their heart because it hurts in their heart what it feels like in your heart when a rib is out in the front.
Right.
And we shift it back in. It costs $35, and they're both relieved and super pissed.
Right. Because much like your wrist, it was I'm better.
It's this.
What?
You had to shift one thing.
Right.
Yeah, and it's not always that. If it took years to put out, then it's not often going to stay with one adjustment, but you can feel your body coming closer to freedom. Really.
Right.
That's what it feels like to me.
And just recently we were saying that pain is kind of the last resort for your body to actually get there.
Pain is one of the last indicators that there is a problem. It's one of the last things that comes and one of the first things that goes away. I mean, unless you twist your ankle, you'll feel pain pretty quick.
Well, right, yeah, for sure.
But if you have problems that are addressing function, you can have a function that is not working well for a long time and just not know it. You just basically start to lose the intensive neurology that you usually feel. Our bodies are on a constant feedback cycle with our brain. So our brain sends information out through our spine to control everything, and then our body sends information back up to our brain. And if you have spots that aren't working well, that aren't moving well in the joints, especially the spine, then you're breaking that feedback loop. It's like your brain needs a battery charge that comes back up through your spine and you're not getting it. So it's just decreased function. It's like making us less of what we could be.
So you're saying that I need to start preventative maintenance, much like a dentist appointment or a regular visit at your, general practitioner.
Yeah.
Chiropractic visits can go into this, I'm going to say, a normal cycle of maintaining your body or getting things back to normal, because it can help all of the preventative. It can help all of the different heart issues that women may have. Maybe it is a rib. Maybe it's, men too. And you guys are a full service chiropractic office.
Yeah.
So kind of tell us a little bit about your services in the last 5 minutes that we have.
Well, going back really quick before I do, I would say thinking about it like a dentist has really helped me understand. I grew up thinking chiropractors were quacks. That when I decided to be a chiropractor, my father was very disappointed. All the chiropractors he knew were broke and crazy, he thought. So I did not make him proud. But I grew up
Don't
hearing...
know about the broke part, but you sound kind of crazy, doctor. So
Yeah.
I grew up, when I grew up hearing once you go to a chiropractor, you have to keep going or it'll slide out. And I grew up hearing that they just want you to come back a whole bunch of times. And I can see now how those misnomers would be there, because often when people find chiropractic, they decide to continue with it.
Right.
What I didn't know then was it is a lot like taking care of your teeth. I mean, that used to seem crazy. People used to think like dentists were nuts. Like, you wouldn't do anything with your teeth. Why would you ever? They would just rot, and then you pull them out and you move on with life.
Right.
And I don't really love that.
No.
Nor do I want that for my full spine. That is like my nervous system, my master system of my body. I want, if I can pick one system to be working well, it's the one that controls all the other ones. But you save so much money and so much time and so much productivity if you check what's going on and get things in alignment when it just feels like something isn't moving right, way before your body has to scream at you for pain. Once you're in pain and inflammation, you can still be helped, but it not only hurts a little more, but you have to do it, closer together to get the muscles to let go. And it's just a really great way to take care of yourself and save time and save money.
Well, and one thing that I do love about your shop too is not only can I go in and get adjusted, but I can get a massage to help my muscles relax and then get adjusted so that it stays longer, because my muscles have been tense around all of the things that need to be adjusted for so long. Getting them to relax a little bit more through a massage therapy treatment and then get adjusted helps them stay in significantly longer.
We are really picky about the massage therapists that we bring into the office. Well, we're pretty picky about everybody we work with, because our patients become our family. Yeah. Exhibit A across from me. But so they are trained in how to get into certain areas like your shoulders, your hips, and really actually release them, not just like a feel-good massage, which is valuable, but they really are part of the team. We also have, so my husband is a chiropractor as well, and he does lots of really cool things with sports injuries, with neurology in the muscles and releasing. I do a lot with pediatrics, with pregnancy. We actually have 2 other chiropractors working in our office part-time. One, her name is Donna. She moved here from Vegas so that she could be a part of our practice, and she's fantastic. She does a lot of work with energy, lower force techniques. And we have Dr. Peterson. He's actually getting his work done to be a functional medicine guy as well. So he's working really hard at that. And he does a lot of things with applied kinesiology. If anybody knows what that is, it's super cool.
Well, no, and it's great to have a well-rounded team so that we can come in, clients can come in, newbies can come in and be like, I don't know what's broke, but I know that I'm broke.
And then we get you in with somebody, and the doctors work well together. I think another thing I like about our office that I want to change in chiropractic in general is understanding, some people will help better in one area than another person, and we're good in our office at saying oh, you need to see her for your shoulder, you need to see him for this is something that he does really well. Right. And I really like that, because as a patient in other places, I just like to know that they care about me, not about the money or the clout.
Dr. Whittaker, thank you so much for being in today. We appreciate your time on Wired Wednesday.
I don't want to steal any thunder from the doctor.
Okay.
But I used to have serious pains in my glutes, and I found the cure for it.
What?
I quit taking calls from my boss.
That'll work for a minute.
Yeah.
Thank you so much. And you can find Whittaker Family Chiropractic back behind Smith's on what street?
Sunset Drive.
Sunset Drive.
Turn at All American Diner.
Turn at All American Diner, and then it is your next right. Thank you so much for joining us. This has been Wired Wednesday with McKinnon Hansen, your local Farm Bureau financial agent, and you can reach me for all your insurance needs, from commercial to succession planning, at 435-592-2021. Thank you for joining us for Wired Wednesday.
Thanks, ladies. Appreciate it. And